I'm going to start off by presenting some information that's been around for a while, showing allegedly a relationship between uh, diet and breast cancer in particular. This actually may surprise many people, but this is a topic that's been around for more than 200 years. Uh, I think it was about 1805. In London, for example, there was a proposal put forth by a fairly distinguished physician at that time to study the relationship between breast cancer and diet, and it was turned down. This was the Middlesex Hospital in London. And then a couple years later, resubmitted it. It got turned down again. And I happened to have had an opportunity to look at those proposals. And it was really sad in a way because it was not clear why, in fact, they turned it down. But they did. And it's been that way ever since, I would argue, except in the last 10, 20, 30 years, we've been seeing some increased interest from the research community in this topic. But the results have been, according to some, quite disappointing, others quite promising. So I want to go through and just make the point that just talk about the kind of preliminary data that we do have that suggests the relationship. And I'll leave it up for you to decide. Let me come back to follow up on what Tom did regarding his conclusions of the more recent data, the intervention trials. I want to turn your attention a little bit to the so-called ecology studies, cross-sectional studies, as well as the prospective cohort kind of studies where we just sort of look at people and then make some decisions about what they're doing, what they have been doing in the past, and what the current rates of disease might be. Here's a study here where it was a study published by actually a friend of mine, the late Ken Carroll, at the University of Western Ontario, published it in 1975, showing for a bunch of different countries the relationship between total fat intake and breast cancer. And I think you would agree that's a pretty impressive relationship. That got publicized a lot at the time, certainly led and encouraged people to think that higher fat diets was related to breast cancer, and surely looking at these kind of data certainly would lead you to that conclusion. You can see on there the U.S. being near the top. But let's go back and analyze this information a little more carefully. And incidentally, I added some twist to this interpretation of these data after discussing it with Dr. Carroll. So I think I can say I have his blessing on the way it was interpreted. Let me go back and show you first. What the heck's going on? I want to switch to the next one. Can we get this here switched? Okay. Sorry about this. We're getting a good practice run here today.
There we go.
Okay. Would that do it? Now I can't see my arrow, so I want to go back.
Yeah, no.
I want to go back to the first one.
Flip the pad. Is that it?
Yeah. Okay. So anyway, there we have it. Relationship between total fat intake and breast cancer. As I say, I sort of added some new information to this with the blessing of Ken Carroll. Let's see what we get to next. First off, that red line I drew there is a regression line sort of describing the data best. And you can see there's a so-called threshold there, meaning basically for those countries who have the lowest breast cancer rates close to zero, they're still consuming significant amounts of fat, maybe 6, 7, 8% of fat or so, which incidentally corresponds with the amount of fat we actually need in diet. I mean, fat is essential. And so it does, in theory at least, correspond to that. Now let's go to the next slide. And this was taken from Dr. Carroll's data in a later publication. Basically, it shows that when he compared plant fat intake with breast cancer, there seemed to be no relationship. However, when he considered animal fat intake, there was an impressive relationship again. So what was seen for total fat seems to be attributed largely to the consumption of animal fat, if you will, if we're just focused on fat. Here in this case, the fact that there's no threshold suggests that as soon as a little animal fat is added to the diet, in theory, breast cancer starts to go up in opposition to what we saw with the total fat. So animal fat seemed to be a bit of a problem here, supposedly. However, I took the liberty of going to some other information published about the same time in the 1970s by some epidemiologists on the relationship between total fat intake and animal protein intake for different countries. The correlation specifically was 94%. That's almost perfect, I should say. So as total fat goes up, it goes up in response to the consumption of animal protein, or let's say animal foods, basically. So there's a really tight relationship between total fat and animal foods, if you will. Okay, now we're going to go one more. And so now I'm sort of relabeling this original slide of Dr. Carroll's and showing that relationship that he published, where there was a threshold, it suggests there that, there's something about theory, at least, a little bit of animal food at this particular point in time is not associated with at least a breast cancer risk. Doesn't say anything about anything else, but that's what it says here. Now, so that set of slides then suggested that, there's certainly an impressive relationship between total fat intake, which in turn seems to be related largely to animal protein intake. Now I want to go back and just sort of compare this with some information we got in the China study. It turns out that there, and incidentally in China, breast cancer was really very low in China compared to these other countries, about only 1/6 as high as in the United States, for example. And so when we compared breast cancer and a bunch of other cancer mortality rates with, let's say, plasma cholesterol, which in turn is related to heart disease, as you know, it showed we were able to see a very positive association between plasma cholesterol levels and breast cancer mortality rates. And then just to give you some perspective on where our study stood in regards to the other countries that were evaluated by Dr. Carroll, you can see here that in China, that square, that inset at the bottom there, you can see that the range of fat intake and the range of disease risk we're talking about in China is down here in this quadrant here, compared to virtually all the other studies that have been done. The ones, for example, that Tom talked about are up here in the upper right quadrant. In fact, most diet and disease studies that have been done to date are on Western populations for the most part. Sort of leaving unanswered the question if we see a relationship up here, we might, kind of a narrow range, we're compromised. But if we see any relationship up here, and then we consider that the rest of the line going down there, the China study, in part, was an opportunity to say, hey, let's look down here in this lower quadrant to see if we see the same kind of relationship we might see at the upper. And if we were to see that kind of thing, we might be able to draw some more significant conclusions. Now, in terms of drawing more significant conclusions, I'm going to turn your attention to what we actually saw in the China study. Most of this population where breast cancer risk was quite low. As I said, from an experimental point of view, you wouldn't expect to see much. But here's what we saw. Just quoting here from some papers that were published from our China study, including this one that you see the name there, Pike. A man by the name of Malcolm Pike. He was the Regis Professor of Medicine at the University of Oxford, probably the most distinguished person in the world at that time, maybe I guess still is, in terms of looking at the relationship between estrogen, circulating estrogen levels in the blood in breast cancer. Here's what they quoted. There is overwhelming evidence that estrogen levels are a critical determinant of breast cancer risk. That's been a conclusion that's not only drawn by Dr. Pike, but also by others as well. And estrogen, in this context, in terms of what we measured in the China study, estrogen levels actually represent a large collection of female hormones. The best indicator in that bunch of estrogen-type compounds is what we call E2 or estradiol. So that's what we're drawing our conclusions about. So we saw a relationship between estrogen levels and breast cancer in our study. Here's another sort of an observation that was published in 1997 in a report by the World Cancer Research Fund that involved a panel of 16 people from 10 different countries. Actually, I was the chair of this report. What was summarized in that report regarding breast cancer and animal plant-based foods is one of the things we did in the study, I should say, is we gathered all the studies we had access to in those days and tried to evaluate, how diet and its various components might relate to various cancers, and made this observation here. We basically concluded there was that breast cancer was likely more related to the protective effect of plant foods than the promotional effect of animal food. So we had evidence that the more plant food consumption in all these studies, the greater was the risk for breast cancer. And more specifically, of 144 human studies that were collected at that time, that showed a statistically significant association of fruits and vegetables with cancer, all 144 showed a protective effect. And these are all statistically significant. So with that kind of observation, it really just gets your attention. Can't say anything terribly positive, I guess, yet, but we certainly can say that there's a very strong association, at least, between the consumption of fruits and vegetables with breast cancer. Let's go to the next one.
Quick on the slide there.
And turn our attention then to the question concerning the blood estrogen levels that I mentioned before. This is a comparison of Western women. In this case, they were British women, actually. British women with rural Chinese women. And what we found amongst the Western women, typically, of course, found in this country too as well, estrogen levels in Western women was somewhere in the neighborhood of 1.4 to 2.7 times more blood estrogen in Western women than there were in the Chinese women. Simultaneously, there was also more blood testosterone as well. 1.3 times more blood prolactin, another hormone associated with the emergence of breast cancer, and somewhat less amount of so-called sex hormone binding globulin. Now, that relationship is exactly what you might expect if one assumed that there was a relationship between estrogen levels and breast cancer. Sex hormone binding globulin is a form of estrogen that circulates that's bound and is thought to be less active. So, in other words, it would tend to a lower level of sex hormone binding globulin, as we see here, is equivalent to a higher estrogen activity. So that was all consistent. So in summary then, and incidentally, for those of you who may not have seen this, it's in the China study. We have this chart. Tom and I put that in our book. Let me go through this just in a little bit of detail, including some other data that I did not show. Namely, let's talk about rural Chinese first, and the X and Y axis. This is shown here versus chronological age, the age of these women, as it relates to the circulating levels of blood estrogen. For the Chinese women, age at menarche in a Chinese woman the average age was 17 years, really surprisingly high. And at the time that sexual maturation comes to the young American woman, at that time, then estrogen levels begin to surge, and they remain high during the reproductive years. And then they decline down to something much less when it comes time for menopause. So the Chinese women, these are real data, average age of menarche was 17 years. Average age of menopause was 48 years. In contrast, for Western women, as you can see there, it's quite different. Western women, average age of menarche in those days, what we had available to us, average age of menarche was 11 and a half years, average age of menopause 52 years. So there you can see just the length of the reproductive period for the Western woman is pretty much higher than, let's say, the rural Chinese woman. At the same time, and I drew the lines, as you can see there, to reflect on the estrogen levels. That is to say, in the Western women, this collective bunch of estrogens, if you will, or female hormones, the average amount of female hormones in the Western women was about 40% higher, 50% higher or so, than the rural Chinese women. And you put those two metrics together, the circulating levels of estrogen during the reproductive years, together with the length of the reproductive period. It turns out that estrogen exposure in the Western women is about 4 times greater than it is for Chinese women. Similarly, breast cancer rates among Western women is about 5 times higher. So there was a good correspondence. And the reason it's become interesting is because, as I showed in the earlier thing from Malcolm Pike, Dr. Pike, he concluded estrogen levels are a really good indication of breast cancer risk. And so here's just a sort of a quick summary that just the top 3. I drew this from another slide, so don't look at the rest of them, but this is all from the China study. Namely, that we were able to show a relationship between breast cancer and dietary fat, something I didn't show here, but that was a separate publication done by Professor James Carroll at the University of Buffalo. We saw a significant relationship between fat intake and breast cancer, even though dietary fat at the time was really quite low in the rural Chinese. We saw a relationship between estrogen and breast cancer. We saw a relationship between age of menarche and breast cancer. The reason I listed all these 3 here from the Chinese cohort is that this is consistent with what we see in Western women. So you start putting all this information together, and you really have to conclude there's got to be some relationship here. My gosh, it's really quite impressive, I think. Here it is for breast cancer and milk consumption, which you might imagine might be true, just based on what I had just said. We put this together some years ago, and this is a publication out of Harvard showing a really impressive relationship between milk consumption and breast cancer, going through 0, which suggests in theory that as soon as some milk is added to the diet, we might expect to see some kind of results, at least in correlating different countries' dietary habits. The same is true for uterine cancer. Different numbers, I must emphasize, but the relationship was virtually the same. And then we go to things like prostate cancer in men, another reproductive cancer. And here again, we see that when comparing prostate cancer mortality rates for men aged 65 to 74 years, this is 1986 data, and compare those rates with, for example, the consumption of skim milk or non-fat milk, if you will, you can see a really, again, an important and a significant relationship here. Again, these studies, these graphs, if you look at them standing alone, we're not allowed to say anything definite from such things, but they certainly are very suggestive, especially when you start comparing this kind of information with other sources of information. Now I'm going to go through here. We got to take a little time for some questions, but just to follow up on what Tom said earlier about the intervention studies, here's another study here, was a prospective cohort study. You've heard of it, I'm sure. Nurses' Health study out of Harvard, where they were actually comparing just the routine habits of American women, American nurses in this case, in respect to the odds ratio for getting breast cancer. And they divided these women all up. There was about 97,000 women, I think, at that time. After 8 years, after 8 years of study, they could divide it up to deciles. And you can see here that there seems to be no effect or no relationship between the amount of fat in the diet and breast cancer. If anything, you can see the little red dot, not significant. If anything, might be slightly increased the lower fat intake. Here's what is significant about the Nurses' Health study. And I have to say, when this came out, made the headlines of the New York Times, it almost in many ways had a very negative impact on the whole idea that diet was related to cancer in any way. Here's the interpretation of that from my point of view. Namely, as these women decreased their fat intake through some education, going forward over those years, as they decreased their fat intake and the ones consuming the lower fat diets, they didn't see much effect on breast cancer, if any, basically nothing, but they actually increased their protein intake, especially animal protein. Their consumption of vegetables and fruits did not change in the study, and that's from their own data. But if anything, their protein intake at the high fat levels was already high. And as you decrease fat intake, you actually make the protein intake even higher. It's something close to about 19% of total calories at the low fat level. And so we know from other studies that I'm not showing here that the higher the animal protein consumption, the higher the estrogen levels, and also the higher the breast cancer risk. So, I just added another little red dot there. You can see on the left, a theoretical one. I'm suggesting this, that none of these studies, the one that Tom talked about, the intervention studies, and certainly the prospective cohort study in this particular case, none of these studies have included a whole food plant-based diet. And that's the one we're really interested in. That's the one we would like to suggest. there's I'm going to say, very possibly a major effect of dietary practice on breast cancer, but I'm suggesting as a hypothesis, we don't have enough good evidence at the same time, but quite frankly, we've never really tested the idea. And in terms of all the other studies that have been done, they're trying to make conclusions about them, and I think it's just simply false. When they come to the conclusion that that diet is likely to have very little or no effect on breast cancer, I don't believe it. I simply don't believe it because it's never really been tested adequately. I get quite passionate about that because I wish that we could consider that for real and do it sometime.